At Optegra, patient care and patient experience are at the centre of everything we do. And for many years now, we've been providing high-level cataract surgeries for NHS patients, performing over 40,000 a year with very low complication rates, but we don't want to stand still. So we've been thinking about how we can improve patient experience in as many ways as possible. And so there are three main projects that we've considered. The first is to offer patients both eyes on the same day, bilateral surgery. That comes from the fact that in our private pathway, we've been offering that to patients for years. It's kind of our bread and butter, and extending that now to NHS patients. Secondly is to consider offering patients surgery on the same day that they come in for their initial assessments. Published in the Eye Journal, showing that patients really receive this very well. And the third is offering dropless cataract surgery, that is post-operatively no medications whatsoever. And this comes on the back of a number of publications, probably most notably one from America, of around about 70,000 patients receiving an injection of steroid during the surgery, which then means that they don't need any drops at all. So those three projects really centre around patient experience. Having both eyes on the same day and having an initial on the same day as your surgery, it allows the patient to minimise the number of visits that they have, and that has obvious benefits for them, but for their family, because most of the time it requires a member of family, a carer, to come in with them too. As far as I'm aware, Optegra is the first to offer all three of these pathway changes simultaneously. None of these things are experimental, they're things that are being published extensively, but putting them all together in one package for the patient to get the best out of the experience, that is something that I believe Optegra are pioneering.
When I was speaking to one of the surgeons, he was saying about there'd possibly be a chance of getting on to do some tests of having both eyes done at the same time. And I thought, brilliant, because I was worried about the fact that if I had one done with my prescription level that I'm having, that I would have trouble seeing. So 2 eyes at the same time meant I haven't got to worry about having 2 ops. And 2 lots of everything, yeah. So, and apparently now they do a procedure which means you don't have to have eye drops, which is going to be brilliant, because I mean, hopefully I'll walk out of here and within a couple of days take the covers off and that's it.
Not having to take the eye drops after the surgery would be quite good for me, because I'm not the best person for putting in eye drops anyway, and that seems to be a very good move forward in the treatment of cataract surgery. Coming here in the morning, having all the pre-op treatment and the measurements, and then obviously having the surgery done on the same day is an absolute bonus for me, you know. And initially I was thinking I was going to have one eye done and then the other one 3 months later, so it's an absolute brilliant method of having it done.
It'll be beneficial. You've got the one trip and everything's done. You're not backwards and forwards. Saves time, inconvenience, and in the space of one day, you're getting your sight back. So brilliant.
From the dropless side of things, that obviously has huge benefits for patients too, because one of the biggest complaints we have from patients is the post-operative medications. They have side effects, they sting. Patients have trouble putting them in, particularly if you have arthritic hands or something like that. It becomes very difficult to administer the drops yourself. You often rely on family and friends to do that for you. So if you can allow a patient not to have to use any of those, again, it just makes the experience far more seamless for them.
I understand that previously drops were always administered, obviously really good to keep the eye free from bacteria. And I wondered, well, if I'm not having them after this, how am I going to protect the eye? And it was all explained to me that they do a steroid injection in the eye. So that would be amazing. It saves about 4 weeks, the drops and remembering to do them, the inconvenience. So couldn't be happier.
So the patient response has been fantastic. So we had a pool of patients in whom we'd selected as possible candidates, and then we spoke to all of them. The vast majority of patients were very, very excited about this, because no one wants to have to come to hospital. If you can minimise the impact that it has, both logistically on time, but then also on aftercare too, then patients are very excited about it.